Through a collaborative partnership with Hope Hospice, Shell Point has provided hospice services across the continuum of care since 2002. Located on the 4th floor of the Larson Pavilion Skilled Nursing Center, Shell Point's 9-bed general inpatient hospice unit offers both symptom management and end-of-life care in a beautiful waterfront setting. Shell Point's medical director, Dr. Roger Herchak, speaks with marketing and communications director Lynn Schneider about the decision to bring hospice to Shell Point.
About 15 years ago, Lynn, the president and I got together and talked about hospice services for Shell Point. About the only service we did not have at Shell Point was hospice. And at that time, President Peter Dice said we should have hospice services at the end of life, or if someone is hospice served and they're in need of pain and symptom management, why would we want to send them to another location? Our job is to keep our residents here at Shell Point. So 15 years ago, Mr. Dice and I met with the CEO and president of Hope Hospice, Samara Beckwith, and said, how could we make Shell Point another site for Hope Hospice with a blending of staff? So after a number of other meetings, we made it happen. So in July, it'll be 15 years that we opened our hospice unit. And we were fortunate at the time, Lynn, because the annex had just been completed on the 4th floor. And that floor had 9 private rooms with the most pristine views over the island and over the lagoon. And I said to Mr. Dice, could this be our location? And he was gracious enough to say yes. So in conjunction with Hope Hospice and our staff, we had a blending of staff and we opened up our hospice unit.
Samira Beckwith, President and CEO of Hope Healthcare and Hope Hospice, talks about the importance of hospice and their relationship with Shell Point.
It has been our pleasure to have such a positive relationship with Shell Point. And over the years, in fact, even in the beginning years when I first came to the community, I came and met with the administrators at Shell Point, and we talked about how to better serve the residents and decided that it was best to keep people as close to home as possible. And because we wanted to do that, we were able to establish, I really believe, a unique relationship and a unique opportunity to have Hope Hospice at Shell Point and establish the special unit that we have there, as well as caring for people in their own independent living or assisted living or skilled nursing facility.
Dr. Herchak clears up some misconceptions about hospice care.
One of the misconceptions, Lynn, is that hospice is a place for people to go to die. You go into a hospice unit, for example, that we have on the 4th floor, you get plugged into a morphine infusion and you die. And that is so far from the truth. If you qualify for hospice with a diagnosis, it may be a cancer diagnosis, cardiovascular diagnosis, end-stage dementia diagnosis, and a provider, physician, or nurse practitioner feel that you have 7 months or less to live, you would qualify for hospice services. So I always say you lose nothing, but you gain everything, because you get to keep your primary care doctor, you get to keep your ancillary services, but hospice will supply you with medications that are related to your hospice diagnosis. You will get access to an RN, a number of other services, chaplain services.
And now that I'm the Director of Spiritual Services, I have the opportunity to follow them from the time they come in, live here for long-term care, or in the dementia unit, and they become like family to me. So when they come to hospice care, since I've had a little bit of a history with them, I have the privilege of being able to kind of be with them until the last breath, which is to me a really wonderful thing.
Sunny Torres, the Director of Spiritual Services, stresses the importance of helping patients and their families during and after their hospice stay.
It's an important part of their lives, the spiritual side of things. And even though death is a very physical thing, it's where your soul and your body have to make the split. And for them, they just need encouragement that that they're going to be okay.
But it's not always a one-way street when you get into the hospice unit. In order to qualify, someone could be hospice served, but yet they may not see me in a GIP unit. That floor is like the intensive care unit of a hospital. If one's symptoms cannot be managed at another lower level of care, and that could be chronic nausea, pain, restlessness, shortness of breath, and then you qualify to come up temporarily to the GIP unit, into that intensive care unit, where they're seen by a doctor every day, and they get intensive care. So not everyone that goes to the GIP unit is there for a one-way stay. We very often discharge people back to their home.
I really believe that hospice care at Shell Point is so special because both organizations want the best care possible for the people that we serve. And because of that, both organizations, the staff, all work together, and the volunteers, to be sure that the care is the best possible.
The hospice unit at the Larson Pavilion is successful due to the collaborative efforts between hospice and Shell Point employees, along with the help of resident volunteers like Janet Bendel.
I feel what I can give is really trying to help the nurses, do what I can to help the nurses. Most of the time, the people here on the floor have family visiting with them, or friends, because we're so close here at Shell Point. But I feel I can do something to help that family, maybe. Oftentimes my time is spent talking to the family, or I can do anything I can to help the nurses. It's not easy for them, but to have a shoulder, somebody to talk to. Sometimes that's all they need, is just somebody to talk to. So all I do is listen. I can get them a cup of coffee if they would like that, or just listen. That's all I need to do, is listen and give a little bit of support. A few hugs. Hugs are always good too.
We really believe at Hope that the Shell Point residents, as well as many people from the community, benefit by having the Hope Hospice unit at the Pavilion, because they can be as close to home as possible. They're able to visit their friends, their family members when they're there, and they're able just to stay in their own community.
Shell Point's business software analyst, Marcia Hawkins, has experienced these benefits of hospice firsthand.
I work in the IT department at Shell Point, working with software, trying to help people with their problems on the computers. And I'm the youngest of 5 children. And as Mom got older, I decided to move back home here to help take care of her, knowing that eventually she would need more help. Later on, she needed the hospice care. Being able to have my mother here while I worked here was fabulous. The nurses and the aides were all so wonderful here at Shell Point. One of the things I like most about hospice is the loving nature of caring for your loved one in such a special manner, making sure that they're comfortable. And not only that, the nurses and aides made sure I was comfortable.
We try to get people out of pain and still stay alert enough to carry on conversations with their loved ones. And through hospice services, we're able to do that.
For our family, it was a difficult, heart-wrenching decision to put someone in hospice care. You think, oh, that means they're going to die tomorrow. No, it doesn't. It just means that they can get the care that is truly needed.
At hospice, our unit of care is the person who is the patient, as well as the family members. So we really do focus on the family members equally in the way that we focus on the patient.
Just being able to be there and to draw something of life out of the families is really helpful, I think, even for the resident who's hearing all this, because, you know, just the comfort of having their family there.
Because it's a passion of love. I try to meet people where they are, to get people to sort of buy in and feel comfortable, and to say, oh, by the way, this place feels different. It's great. I'm so, especially for people from the outside community, Linda, are not, you know, used to Shell Point, not Shell Point residents. They'll say, boy, this is unique. I just feel the presence of love and the presence of the Lord. We came to the right place. And when our staff hears that, we've accomplished our mission.
Because I believe that Shell Point will continue in that same tradition of wanting the best for people.
Learn more about Shell Point's hospice care by attending the panel discussion on July 31st in the Social Center at 2:15. Gain a better understanding of the benefits of hospice care, how these services address each level in the continuum of care, and common myths pertaining to hospice. You'll hear from a panel of experts including Medical Director Dr. Roger Herchak, Support Services Manager Janine Hammond, and Debbie Gowing of Hope Healthcare Services. Make sure you sign up today at either service desk as space is limited.